Hello everyone, welcome back to my YouTube channel. How are you all doing? Today we're gonna talk about a few things in medication administration. So now we're gonna start with Codex. What is Codex? Codex is actually and kind of a book that the doctors write patients medication, and nurses use the same book, like where after a doctor must have prescribed medication and written it up in the codex, the nurses read that before they administer any medication. Codex is mostly used in Republic of Ireland and in UK. In other places, they have names like pres- prescription records and different other names in different countries. But as a doctor, once you prescribe a medication for anybody, it has to go into codex. And as a nurse, of course, all nurses know this. You won't give a medication that is not written down in the codex. That's professional code of conduct. You know what I mean? Okay. So then, okay, one important thing, sometimes when medication is not written on the codex, the only situation it can be given is in emergency. And before a nurse does that, she has to contact the doctor over the phone, and the doctor will prescribe a medication. But not only just only one nurse to listen to this, but two nurses and repeat whatever the doctor has said. Then the doctor will fax the prescription, and afterwards that will be written down in the codex. So as a medical student who is going to be a doctor, when you prescribe a medication, make sure you write it, put the date, the time, if is it irregular or is it impurine. These are all important. As for student nurses, you're not gonna give any medication that's not written up. You know what that means. So be careful and know all this is important in your practice as a medical doctor or as a nurse. All right. One other things I want to talk about today is the rights of medication administration. Initially, we had five rights, then it went up to seven, then I think now we have up to 10. Okay, I'm just gonna read this out. So, first one is right patient. When we talk about right patient, sometimes you have five Marys in one word, so you have to know their second name. Make sure is that Mary Sweeney. If they're the same second name, check their date of birth, check their hospital number to make sure you are having the codes and the right patient. That's what right patients mean. Then right dose. When a medication is prescribed, it's important it has the dose. With tablets, it's so easy, but sometimes with liquid medication, assuming a doctor prescribes 20 milligram in 5 ml, then they put in there 10 mils. You have to do a little bit of calculation there. So it's important. If you're not too sure, please ask. It's important. That's right patient. So you don't give somebody's medication to another person. I mean, right dose, sorry. So you don't give wrong dose to a patient. Then another one is right drug or right medication, giving the right medication. Sometimes we have medications that do the same thing, but the content somehow might be different. Example, if someone has condition of epilepsy, if the doctor writes Epilim Chrono, please give Epilim Chrono. If you don't have Epilim Chrono in your trolley, ring the pharmacy. Don't decide to give Keppra, because Keppra and Epilim, they can be used to treat epilepsy. Be careful and be aware of drug interaction. So that's the right drug or right medication. Right route, as Americans call it, or right route as we call it in Europe, is the right way to administer medication. If it is written NG, it is NG. If it's written PEG, it is PEG. If it is written intramuscular, it is intramuscular. If it is written per oral, it is per oral. Adhere to that. Don't do it easy way for yourself, because that might put you in trouble. And as a doctor, when you prescribe, make sure you write, is it oral or is it injection? Is important. And of course, as a nurse, you're not gonna give injection if it is written oral, because injection has fast release while oral is slow release. So it's important we adhere to instruction written by the doctor. Then right time, of course, we know if it's AM, give it AM. If it's PM, give it PM. There is no need taking AM, giving it in PM, and PM in AM. So it's important. If it's not, give it not. Then we have right documentation. When as a nurse you prepare medication, give it. After giving it, sign it. There is no need one person gives medication, another person signs it, because you cannot account for it. So write documentation and write reason why are they taking that. So as a nurse, of course, you have to know. Then right to refuse. A patient has right to refuse medication. As nurses, with force, we facilitate. If they say no, try to explain to them the importance of taking their medication. But if they refuse, that's it. Just write it down there. Refuse. You've done your job as a nurse. And right equipment, of course, we know if it is, example, nebulizer. It's nebulizer. Give it using nebulizer. There is no way trying to take a different equipment. So, as a doctor, when you write up medication on the cardex, do not forget to write the time, the date they're commencing, and when they're stopping, assuming it's PRN. If you want them to take it for 2 weeks, just put the date they're stopping, so that when the nurse they're giving that, they know what date the person is stopping that. And if it's regular, put it in the regular side, and then we know it's for review after 3 months. So the nurse won't be calling you, doctor, how long do you want this? How long do you want that? You save yourself time and also save the nurses time, because doctors have a lot to do and nurses as well have a lot to do. Now, a lot of professional or registered people have really faced professional conduct review or legal action because of mistakes like this. Maybe it's not written right or it's not administered right way. So please, it's important, because you're serving your patient, you're serving your PIN or your registration, whichever one you are using. It's important we keep to the 5 rights. So now we're gonna look at certain abbreviations in medication administration. So when you take the codex and you say NJ, so you know what it is, or PO. So I'm just gonna read a few NJ and few abbreviations that is very common on daily basis in medication administration. One is NJ, that's nasogastric. When some people can't take things orally, it's given through NJ. So when you say NJ, please give it NJ. Don't try to do it orally, because it's not the right thing. And as a doctor, if someone is on NG tube, when you write their medication, remember to put that NJ in the codex. PO means per oral. PEG, PAG means percutaneous endoscopically placed gastrotomy. That's PEG. You know, when they have PEG there, we give medication through the PEG and their feed. In PEG, you can do bolus feeding, which where you use the syringe, remove that and put it in the PEG and pour their food there. the feed they use or the medication after the flush. And of course, you have to write how many mils you use in flushing because it's always important. Then SC means subcutaneous. We give drip subcutaneously. So always remember, nobody opens the drip and give them orally. I'm sure everyone knows that. Then RX means prescription. DX means diagnosis. AC means before meal. But this is Latin word antecibo. So some medication, especially the bone medications that they take once a week, normally is antecibo. They take it like 30 minutes, sit up before meal. So it's important to adhere to that. TX means treatment. HX means history. So when you see all this, you know what they mean. PR means per rectum. There are some medications we give via rectum, like suppository and enema. That is through the anus. We give that. AM means mane. That's morning. BD means twice daily. If they have medication, divide it evenly around the clock, BD. And OD means once daily. BOL, as I said before, is bolus. We have bolus feeding. And CAP means capsule. If medication is written CAP, make sure you use the capsule one. Don't use the coated one. It's written capsule. Give capsule. C or C or M means cream. If it's a cream, use the cream one. So when you put in your order through the pharmacist, you put cream. Then DC means discontinued. IM means intramuscular, is an injection, of course. IN or NAS means intranasal. ING means injection. IV means intravenous. We give like antibiotic intravenously. They work faster than the oral. Nocte means night, and OTC means over the counter. Like when you buy medication that not prescribed, they're the over the counter. QDS means 4 times daily. TDS means 3 times daily. PM, of course, is evening. PRN means as required. That is when a patient needs it. It's not every day. It's not because it's there, so you give them paracetamol every day. No, it's when they need it as required. NKA means no known allergy, and NKDA means no non-drug allergy. This, you see it in every codex. When a patient comes to hospital, if they have allergy, it's written in bold with red or bold black, so that you don't give what they're allergic to, like a penicillin. If they're allergic to a penicillin, you don't prescribe that as a doctor. It's important you know their allergy so that you don't cause more harm to your patient. You know what I mean? So NPO means nil per oral. It's important. If a patient is written nil per oral, means it means nothing. Don't give anything orally, because they might have problem with swallowing. If you give them, they might get choked. Something might happen to them. You don't want to kill anybody, so be careful. It's important. And the NTE means not to exceed. This one especially when a patient is on fluid monitoring, maybe 1,000 mils a day, and is written NTA, not to exceed. Make sure you don't exceed that. It's important to always adhere to the instruction given by a doctor. So if you're a student nurse aspiring to be a nurse, it's important you adhere to whatever the doctor writes there. If you're not too sure, please ask the doctor. And if you're a medical student, one day you're going to become a doctor, make sure you write correctly. And again, one thing I want to talk about now is when you are writing and you make mistake. I've seen people using the white fluid is not acceptable for those who are practicing nurses. If you have done nursing ethics, and I'm sure somewhere in medical ethics it will be there, when you write all that, try to script it. It might look like you're hiding something. When you make a mistake, just put a single line, put bracket and put your initial. That's so professional, so that if you're checking anywhere any day, everybody will see it. You're not hiding anything. If not, people might think you're hiding something. And if there is a case, it will be like, oh, what's that? Then you start thinking, oh, I don't know, I can't remember. But single line, bracket your initial. That solves the problem. So these are the little things I just want to talk about here for student nurses, for medical students who will be prescribing medication in few months or few years, so you know them and please put them into practice so that when you start it will be so easy for you. So we're gonna end here, but before I end here, I want to say happy Christmas to everyone that is watching, and please remember to subscribe, comment, like and share. Thank you so much, and God bless you all. Have a lovely Christmas, and I'll see you in 2020. Bye bye.